on deaccessing and deaccessing a Metaport. So the first thing I want to do, I'm going to perform hand hygiene, put on some gloves, then I'm going to palpate the port. And then I'm going to have a mat. I'm going to put the mask on a patient. I'm going to have him turn his head. I have my mask on already. I'm going to verify the order, and I'm going to make sure it's the correct patient. So I'm going to go ahead and fill for the port. Okay. Then I'm perform hand hygiene and set up my sterile fill. Okay. So the first thing I'm going to do, I'm going to go ahead and clean the port. And it's per facility policy of how I want to clean the port. So I'm going to go ahead and go clockwise. I'm going to go ahead and throw that away. I'm going to let that dry for 30 seconds. And then I'm going to go ahead and take my port. And this is called a Huber needle. Okay. So I'm going to go ahead, take the port, access. I'm going to make sure that the Huber needle is always touching the back of the port. And then I'm going to take my non-sterile hand. I'm going to aspirate. Then I'm going to go ahead and flush. Okay. Now I'm going to take a clean gauze. Take my Tecoderm. Make sure I'm going to get the there we go. And go ahead and and that is accessing the Metaport. I would go ahead and chart it as well. I'm going to vigorously clean this bottom and put a Curex on it. Okay, so now I'm going to go ahead and deaccess my port. And this is not a sterile. This is not sterile, sorry. So I'm going to check the orders for deaccessing my port. I'm going to perform hand hygiene. I'll go ahead and get an alcohol swab. Perform hand hygiene. I'm going to go ahead and put my gloves on. Have some normal saline here, and if it calls for heparin, then we would do heparin, but for this instance it don't call for heparin, so I'm going to use my saline. So I'm going to take the Curex off, throw it away, and then I'm going to vigorously clean the bottom of the port. And then I'm going to go ahead and flush. I'll go ahead and take the old dressing off. I'm gonna go ahead and pull up. Okay, I'm gonna dispose this in the sharps. I'm gonna get an alcohol swab and I'm gonna go ahead and clean it. Okay. Now I have my gauze and I'm just gonna go ahead and apply a clean dressing to it. Alrighty, the port is deaccessed. Everything's going to be placed in the sharps, and then I'm going to go ahead and document that I deaccessed the port.